Hello friends, this is Sonu and today I am going to discuss about adrenergic antagonist. In a last discussion we discussed the adrenergic agonist. So right now we'll discuss the adrenergic antagonist. Adrenergic antagonist means the drug which block the adrenergic receptor and their action, or we can say the drug which antagonize of the receptor actions of the catecholamine drug or the related drug, or we can say sympatholytic drug. Sympatholytic drug. So before the starting the classification and the further discussion, briefly we'll discuss about the receptor, adrenergic receptor, then we'll further discuss about the receptor. We discussed already in adrenergic agonist in details, but for just for the revising, adrenergic receptor, as we know, beta, alpha further divided into alpha 1, alpha 2, beta further divided into beta 1, beta 2 and beta 3. But in alpha 1, in a small subgroup is divided into alpha 1a, alpha 1b and d, because some of the drug of the alpha blocker, selective alpha blocker, which act on the alpha 1a, and some of the drug which act on the alpha 1bd. That's why we should know that what is the localization of the alpha 1a and what is the localization of the alpha 1b and d. Alpha 1a is a localization prostate and urinary bladder, and eye. Alpha 1bd mostly in a vessels. So from here you can think that if any patient is suffering from hypertension, on the time if you give the drug that act on the alpha 1a, it means it will not affect on the vessels, and if you not affect the vessels, so blood pressure will not go in a down. That's why we should know the small subgroup alpha 1a and 1b and d, localization and the function, and the rest of the receptor the function like the similar. Alpha 2, as we know that alpha 2 is the inhibitory receptor, it's inhibit and the localization of the presynaptic platelets and the pancreas. Here beta 1 heart and kidney, beta 2 except the presynaptic platelet and pancreas. For the relaxation case, for the inhibition case, all over in a body are found beta 2, and the except heart and kidney in a stimulation case alpha 1, beta 3 in adipose tissue. So this is the briefly discussion about the receptor. Now we'll discuss the alpha 1 blocker. First discuss alpha 1 blocker, then beta blocker. Alpha blocker. First we'll discuss the what could be the pharmacological effect if you block the alpha receptor in a body. What could be the changes in a body? First, if you block the alpha, it means it dilates the vessels, so all vessels become dilated. Dilate vessels. Second, if you dilate the vessels, it means what? It means that decrease the venous return, and it eventually lead to the decrease the cardiac output, means hypotension. Third, nasal become a stiffness, because if you blocking the alpha receptor, so alpha receptor also present in a nasal muscles and nasal artery. Nasal a stiffness. In eye, meiosis can be developed because the blockage of the radial muscle, that's where meiosis can be developed. Fifth, in prostate, or urinary bladder, be the relax or dilate. So prostate and urinary bladder will be the muscles become dilated or relaxment of the muscles due to blockage of the alpha receptor. Next, in a testis during the ejaculation, during the normal ejaculation need to contraction of the vas difference here. So blockage of the alpha receptor, the contraction of the vas difference become interrupt or become inhibit. That's why the inhibition of the ejaculation, we can say inhibition of ejaculation. Seventh, about GFR, glomerular filtration rate. GFR will be the decrease. Why? Because it's depend on the cardiac output, and as we can say that it has a hypotension due to the dilatation of the vessels. So GFR become decrease. But due to decreasing of the GFR, the production of the sodium and water, the accumulation of the sodium and water become increased. So increase the sodium and water, the retention of the sodium and water increase. Due to this reason, the increased blood volume. And one thing also, due to the retention of the sodium and water, the production of the renin become increased. So that's why if you increase the renin production, it means what? Renin will go in a liver, and then angiotensin will go in the lungs. It's angiotensin 2, and then angiotensin 2 will produce aldosterone. Then aldosterone become more sodium and water reabsorption. So water reabsorption retention become more high. Then blood volume become more, and due to this reason, it may be the heart rate become high. So here, due to the decreased glomerular filtration rate, can lead to the heart rate. How? You can see that what is the main reason due to the heart rate become high. Due to the blood volume increase, the renin production increase, and the retention of the sodium and water more. So this is the main pharmacological effect, or we can say that due to the blockage of the alpha receptor, this can be seen in the body, in the human body, who taking the alpha blocker drug. Now we'll discuss the classification, but before classification, some information about the receptor that we should know. Alpha 1 and alpha 2. For example, in a hypertension patient, if any patients have suffering from hypertension, on the time if you give non-selective alpha blocker, means it's block the alpha 1 and alpha 2 also. So in alpha 1 case, it's dilate blood vessels. It means what? The decrease venous return means decrease the cardiac output. So in hypertensive patients, this is the useful effect for the decrease the cardiac output. But in alpha 2 case, because it's a block alpha 1 as well as alpha 2, and the normal function of the alpha 2, this is the inhibitory, or we can say feedback mechanism. Whenever the concentration of the catecholamine in a synaptic cleft become high, on the time it's give the signal inside the neuron that too much catecholamine and release already in a synaptic cleft. So now you should stop to the release of the catecholamine. So we can say that it's a maintain the catecholamine, it's a maintain the epinephrine and norepinephrine releasing. But by the drug, it's a block. It means that the neuron can't understand, the neuron can't receive the signal from the alpha 2 receptor that they release or not. It means they thought that it's by the drug you block the alpha 2 receptor. It means the neuron thought that no any norepinephrine and epinephrine in a synaptic vesicles, and they're releasing too much norepinephrine and epinephrine in a synaptic vesicles. It means what? if the catecholamine or norepinephrine become increase. So and one thing also, that you block just alpha receptor, you will not block any beta receptor. And here releasing catecholamine, it means it can be block, it can be act on alpha receptor as well as beta receptor. But here you block alpha receptor, so it will not act on alpha receptor. But what about beta receptor? In a heart, the beta receptor are there. Beta receptor in everywhere in heart, like in a SA node, AV node, in a Purkinje fiber. So it act on the beta receptor and the stimulate the beta receptor, and the cardiac output become high, and the patient suffering from hypertension. So on the time need to decrease the cardiac output, not to increase. That's why for the hypertensive, this drug will not use. This is not drug of the choice, due to the, in one side you decreasing the cardiac output, but in the other side by the inhibition of the alpha 2 increasing the cardiac output due to the increase the catecholamine in the blood. That's why in a hypertension, this is not drug of the choice. Why? You can see the main reason. So this is the important concept that you should know. Now discuss the classification. Classification is divided into adrenergic blocker, more correctly alpha blocker. Alpha blocker. First is a non-selective drug, that is act on the alpha 1 and alpha 2. The two drug phenoxybenzamine, and phentolamine. Some of the drug like ergotamine and chlorpromazine and metoclopramide, these are the drug also can block the alpha receptor, but not typical that it can be. First, this drug is block mainly dopamine receptor, like metoclopramide is the anti-emetic drug and it block dopamine receptor. But if you increase the amount of the, or if you increase the concentration of the drug, it can be block the alpha adrenergic receptor also. But it's not typical special for the block the alpha receptor. That's why we will not discuss here about those drugs. The typical which block the alpha receptor, only this drug. This is non-selective. Here the selective drug. First, alpha 1 selective. Prazosin. Doxazosin. Terazosin. And tamsulosin. Here alpha 2 selective blocker, that is just one drug, ohimbine. That block the alpha 2. So once again, non-selective alpha 1, alpha 2, which block the both phenoxybenzamine, phentolamine. Alpha 1 selective, prazosin, doxazosin, terazosin and tamsulosin, and the alpha 2 ohimbine. So these are the main classification which block the alpha receptor mainly. So now let's discuss from the non-selective, that what could be the effect if you block the both alpha and alpha 2. About the effect, pharmacological effect we already discussed. So what could be the indication, in what disease we can use this drug. About the hypertension, we already discussed that why not use for the hypertension, due to the one side you decreasing the output, but in the other side due to the blockage of the alpha 2 receptor, it's increase the catecholamine concentration and then eventually increase the cardiac output. So in hypertension we can't use. Second indication will be the pheochromocytoma. pheochromocytoma. Pheochromocytoma, by the oma you can understand that it's a tumor. So formation of the tumor in an adrenal medulla, and as we know that from the adrenal medulla, the major source of the production of the epinephrine and the norepinephrine. It means tumor formation in the adrenal medulla. So so the production of the catecholamine or epinephrine, norepinephrine become too much high. So for the diagnosis purpose or during the surgery, on the time maintaining of the catecholamine, so we can use these two drugs, phenoxybenzamine and phentolamine. Phentolamine means if you inject the for example phenoxybenzamine, after 5 minutes you can check the concentration of the catecholamine. If the catecholamine concentration become decreased, so you can suspect or you can thought that the patients have pheochromocytoma. So for the diagnosis purpose, diagnosis or during the surgery, like surgeon doing the surgery, so for the maintenance, we can use this drug. So main indication is the pheochromocytoma. Second is the Raynaud disease. Raynaud disease or frostbite, we can say. Raynaud disease. Actually, in this condition, in this disease, the spasm of the artery become too much contract or too much spasm. On the time we need to dilate the artery, that's why we can use the alpha blocker. That alpha blocker present on the artery muscles. So on the time dilate, and the maybe patients feel better. So there are two indication that use for this two drug. About the side effects, one thing also I have to mention that this two drug also little bit effect on 5-HT receptor, that is the 5-hydroxytryptophan or other name serotonin. So little effect on this receptor and also cholinergic receptor. But mainly adrenergic receptor. Side effects, what could be the side effect? Hypotension, we can't say that because the one side is hypotension but other side increase the cardiac output. So we can say that reflexive tachycardia. Reflexive tachycardia. Why? Already we discussed, due to the stimulation of the beta in the heart, and tachycardia will be developed. Nasal stiffness due to blockage of nasal area. Sometimes jaundice can be seen. Nausea, vomiting, and the main major side effect also postural hypotension or orthostatic hypotension. What is the postural and orthostatic hypotension? Postural hypotension, or we can say orthostatic hypotension, the same. It means like whenever person from the sitting position, they stand from the sitting position or lying position, the blood pressure become suddenly fall the blood pressure, fall BP. Again I will repeat that the person stand from the sitting position or lying position, they suddenly fall the BP due to the against the gravity. On those time the blood pressure suddenly decrease. So on those term or on those case we can say postural hypotension. So in this condition, suddenly lack of energy patient can be felt, lack of energy can be suddenly blindness, or in some time also faint. Patient will be the faint. So this is the major side effect. We can say the postural hypotension, major side effect, because the person who's taking this medicine, and the person suddenly stand from the sitting position. So already vessels become dilated due to the taking this medicine, and due to the against the gravity, blood pressure suddenly fall. That's why postural hypotension can be developed, and the patient can faint. The blindness can be appears, and the lack of energy. Even they can't stand. The coordination can be the interrupt. So this is the main major side effects. Contraindication can be the like cerebrovascular disease, or cardiovascular disease. On the time we should avoid the drug. So this is the main side effects or indication of the non-selective alpha blocker drug. Now we'll discuss the selective alpha blocker drug. Let's discuss selective alpha 1 blocker. We have prozosine, dextrozosine, terazosin, tamsulosin. So write prozosine, terazosin. You should get shortcut, it's better. First P, prozosine, terazosin, doxazosin, and tamsulosin. You block the, like by this drug alpha 1 blocker, so block the alpha 1 receptor. By the blocking of the alpha 1 receptor, what could be the indication? First, very popular indication, hypertension. During the hypertension we can use. Second, the very popular disease, benign prostate hyperplasia. Benign prostate hyperplasia means, hyperplasia means the increase the number of the cell in any particular, like where the hyperplasia is developed. So in a prostate the hyperplasia develop, it means the muscles become enlarged, the enlargement of the prostate. And as we know that prostate help to the urinate, so it means the retention of the urine due to this disease. So on the time if you apply the alpha 1, it means what? It's a relax or it's a dilated the muscles, and patients can easy to urinate or help to the urinate on the time. So during benign prostate hyperplasia, this is the indication. Or for example, like this is the ureter. For example, this is the ureter, and in a ureter there's stone formation. But like in a kidney, it's by the traveling it's fixed in the ureter, and the patients have like a very small like 6 mm. The stone is a 6 mm. So without operation it can be go out by the urine. So on the time if you apply the alpha 1 blocker, it means this is the layer of the smooth muscles. It means it's blocked by the alpha 1 receptor, and it become dilated. So it will be the dilated, and the stone could be very easily can be pass, and it can be go out by the urine, by the urinate it can be go out. So on the time we can use the alpha 1 blocker. And hypertension and the BHP, that is the benign prostate hypertrophy. This is the main two indication on the where we use alpha 1 blocker. And the third one there for the kidney stone. But in this condition we should combine some other drug also. We can't use alone. One thing also I forget to mention that what is the main difference between four drugs. Tamsulosin. Tamsulosin is a drug of the choice for the drug of the choice for benign prostatic hyperplasia because it's act on alpha 1A, and alpha, as I know that alpha 1A mostly found in prostate and urinary bladder and eye. That's what tamsulosin is the best drug choice of the BSP, that is the benign prostatic hyperplasia, and it's a very little effect on the vessels, vascular smooth muscles, that is the artery and the veins. That's for the hypertension. It's not good drug of the choice. And about the rest, prazosin, terazosin, and doxorubicin, it's act on the alpha 1 B and D, and that is the found in the artery and veins, all vessels. So 1B and D. So this is the best drug choice of the for the hypertension. So this is the main indication, and the side effects will be the same like of non-selective. First side effect, like if you apply side effects, hypotension, because the concentration of the drug will apply too much, so it means too much dilatation of the blood vessels, and the blood pressure become down too much. So hypotension can be developed, or it can be due to blockage, nasal stiffness, as I said. In some time we can say the tachycardia can be developed. Tachycardia due to the reflexive mechanism. Arrhythmia in some time, but it's a very rare arrhythmia. Or don't forget about postural hypotension or orthostatic hypotension. It's a very common side effect. Postural hypotension and the orthostatic hypotension. Erectile dysfunction, the blockage of the vas differentia, erectile dysfunction, and if you apply prolonged use, it can lead to the sexual dysfunction or impotence. Impotence means the sexual decrease, the loss of libido. Impotence. So these are the main side effects or main indication about the alpha blocker. Next one, the alpha 2 blocker, that is the ohimbine. Actually, alpha 2 blocker ohimbine is this drug is not used for the clinical purpose, ohimbine, because if you block the alpha 2, for example, if you block the alpha 2, so the amount of the catecholamine will be the increase, because it maintain the releasing of the catecholamine in a blood or in a synaptic cleft. Whenever too much increases, too much releases, it gives the signal that you already too much releases, now you have to stop. So they stop. If not releases, they signal that you have to release, they release. But if you block by this drug, you bind. So for the hypertension we can't use, because it can be increase the cardiac output. But in some, like in a sexual dysfunction or the dysfunction of the ejaculation, on the time we can use for the sexual stimulation, we can say sexual stimulation. But due to other side effects, due to other like central nerves, because this drug is the lipid soluble drug, that's why it's penetrate the CNS and different types of the CNS side effects. Due to this reason, for the clinical purpose, nowadays we can't use. So main drug is the non-selective and the alpha selective. For the alpha 2 blocker selective, we can't use nowadays. So these are the main like the indication and the main side effects where we can use. In next session we'll discuss the about the beta blocker, beta 1 blocker and beta 2 blocker, about the indication and contraindication. So hope you will understand. Thank you. Next session we'll discuss very soon.